Hello and welcome everyone. Today we are discussing about troponin level. The main indications of troponin is heart attack, also called myocardial infarction. Troponins are structural proteins found in troponin complex within a skeletal and cardiac muscle thin filaments. A troponin complex consists of three subunits, that is I, T and C, and along with calcium ions plays an important role in regulation of muscle contraction. Each molecule has a specific role in muscle contraction process, such as troponin T attaches the troponin complex to actin filament. Troponin C acts as a calcium binding site, and troponin I inhibits the interaction with myosin heads in absence of sufficient calcium ion. It is a marker for myocardial injury. While troponin C is synthesized in both skeletal and cardiac muscles, troponin T and I are mainly localized in myocardium, thus being referred to as cardiac troponin. The other markers for myocardial injury are CKMB, LDH. Myocardial infarctions are divided into two categories using ECG findings, and they are ST segment elevated myocardial infarction STEMI and non-ST segment elevation myocardial infarction NSTEMI. In STEMI, patient will have elevated troponin and one of the following ECG changes, such as ST segment elevation greater than 1 mm in contiguous leads with reciprocal changes, new evidence of left bundle branch block, or ST segment elevation noted in posterior ECG. The non-ST segment elevation myocardial infarction is an injury to cardiac muscle that results in elevated troponin but lacks the ECG changes. The troponin levels do not start to rise until at least 2 to 3 hours after initial insult. This emphasizes the importance of getting serial troponin spaced 3 to 6 hours apart in patients with suspected ischemic event, but with a troponin that is initially normal. The troponin is not specific for myocardial infarction. It is also elevated in large number of conditions such as myocarditis, pericarditis, cardiac contusion or trauma, aortic dissection, endocarditis, cardiac surgery, pulmonary embolism, stroke, cardiopulmonary resuscitation, defibrillation, chronic severe heart failure, cardiac arrhythmia, sepsis, renal failure, hypertrophic obstructive cardiomyopathy, Takotsubo cardiomyopathy, burns, extreme exertion, post-cardiac surgery, infiltrative disease such as amyloidosis, medications such as doxorubicin, snake venom, transplant vasculopathy, and critical illnesses. Now let's learn about the methods to detect troponin. The most frequently encountered methods nowadays are immunochemical methods such as enzyme-linked immunoassay ELISA, immunofluorescence assay, radioimmunoassay, and immunochemiluminescence assay. There is an immunological phase in which there is a specific antibody and antigen interaction, a second phase in which there is either an enzymatic reaction or another antigen antibody reaction occurs, and which is followed by a final detection phase, which varies according to the detection method used. For ELISA, a spectrophotometer is being used to assess color intensity. For RIA, a radiometer is used to detect radionuclides emission, and for immunofluorescence, fluorophore are detected using fluorometers. The sample required for troponin detection is serum or heparinized plasma. The consensus is that the turnaround time for troponin measurement in a setting of chest pain should be 60 minutes, and individual laboratories should strive to achieve this time. High sensitivity troponin assays are used to detect troponin but at a much lower concentration than classical assays. The detection limit for high sensitivity troponin I is 0.04 ng per ml. A troponin I remains elevated for 6 to 10 days after the myocardial injury. So these are the references for this video. Hope you like it. Thank you. Bye. See you in the next video.